السلام عليكم ورحمة الله وبركاته طلبة المرحلة الثالثة، إن شاء الله تكونون بألف خير وصحة وعافية. اليوم راح نتعرف ونختم المادة مالتنا بالcomplications of tooth extraction، واللي هي تنقسم إلى قسمين: perioperative and post-operative complications. قبل ما نبدي بالcomplications لازم ناخذ شوية بعض الملاحظات المهمة. من يجي لك patient للعيادة needs multiple teeth extraction، شلون تبدي تتسلسل بموضوع القلع؟ So which teeth, whether maxillary or mandibular, should be extracted first at the same session? In general, the maxillary teeth should usually be removed first. Infiltration anesthesia has more rapid onset, and ما دام be more rapid onset إذا be rapid disappearance. And maxillary teeth should be removed first because during the extraction process, debris such as portions of amalgam, fractured crowns and bone chips may fall into the empty socket where بالlower jaw, sockets of the lower teeth, if mandibular surgery is performed. And maxillary teeth are removed with the major component of buccal force. Little or no vertical traction force is used for the removal of these teeth, as commonly required with the mandibular teeth. احنا قررنا انه الماxillary teeth to be extracted first, then the mandibular teeth. Which teeth to be started first to extract? Posterior teeth or anterior teeth? Tooth removal usually begins with extraction of most posterior teeth first. The tooth that is the most difficult to remove is the canine, should be extracted last. Thus, for example, if teeth in maxillary and mandibular teeth left quadrants are to be extracted, the following order is recommended. التسلسل المطروح الآن هو اللي نتبعه: maxillary posterior teeth أول شي نقلع، ثم maxillary anterior teeth leaving the canine, maxillary canine, then mandibular posterior teeth, then mandibular anterior teeth leaving the canine, then lastly is the mandibular canine. الآن نبدي مع موضوع المحاضرة الرئيسي اللي هي complications، واللي هي قلنا تقسم إلى قسمين: perioperative complication, which are those complications that occur during the surgical process or procedure, and post-operative complication, which are these complications occur during and after the surgical procedure or post-operative to the surgical procedure. So complication can arise during the procedure of extraction or may manifest themselves following the extraction procedure. ممكن أحيانا نسميها immediate extraction or immediate complication. These occur at the time of extraction, and post-extraction complication or post-operative complication that can occur a variable length of time after extraction. ومثل ما نشوف الآن the perioperative complication or the immediate complications are extraction of the wrong tooth, fracture of the crown of the adjacent tooth or luxation of the adjacent tooth, soft tissue injuries, fracture of the alveolar process, fracture of maxillary tuberosity, fracture of the mandible, broken instrument and tissues, dislocation of temporomandibular joint, subcutaneous or submucosal emphysema, displacement of root or root tips into soft tissue, displacement of an impacted tooth or root tip into the maxillary sinus, aspiration of the extracted tooth, hemorrhage, or enteral communication and nerve injury. بينما post extraction complication are dry socket, trismus, post extraction hemorrhage, hematoma, edema, infection, acute osteomyelitis, and oroantral fistula. نبدي with the first one اللي هو extraction of the wrong tooth. Usually نقلع adjacent tooth يعني in a wrong way. Permanent tooth in a state of primary or deciduous tooth. A tooth on the wrong side of the jaw, especially in incorrectly labeled radiographs or referral slips. بالذات من تاخذ أشعة وأنت تتوهم بها الأشعة عبالك هاي مال left لو مال right وتقلع السن الخطأ. السبب الرئيسي في قلع السن الخطأ هو ال communication. ماكو التواصل بينك وبين المراجع. So most errors occur due to confusion, التباس, and miscommunication between the clinician with the other members and the patient himself. لذلك you will end with extraction of the wrong tooth. If discovered at time of surgery, tooth should be implanted, re-implanted again and stabilized. Unless the patient was referred from the orthodontist, then contact the orthodontist and decide whether to implant or not. Patient should be informed and the dentist take the responsibility. هنا هي إنه الطبيب الأسنان هو يأخذ مسؤولية هذا الخطأ اللي صار. الcomplication الآخر هو fracture of the crown or luxation of the adjacent tooth. Fracture of the adjacent crown occurs especially if it have extensive caries or a large restoration. الادجيسنت توث ممكن يصير به فراكتشر اذا كان بحشوه كلش كبيره او هو بفد ملعب السن بفد سلايت موبيليتي او بتسوس كبير جدا. So luxation or dislocation of the adjacent tooth occur when a great amount of force is exerted during the extraction process, particularly when the adjacent tooth is used as a fulcrum. بالذات احنا دائما قلنا نستعمل الفولكرم هو الالفيولار بون، مو تستعمل adjacent tooth as a fulcrum for extraction. And when an adjacent tooth is inadvertently excited or partially avulsed, انخلع بصورة جزئية, the tooth is stabilized for approximately 40 to 60 days, and if there is still pain during percussion even after this period, then we have to make endodontic treatment for the tooth. عندنا soft tissue injuries, inadvertent manipulation of instrument like the slippage of elevator during the removal of tooth يسوي لنا injury بالsoft tissue. انت ما لازم الأداة بشكل جيد او ما مسيطر عليها بشكل جيد، من الممكن يصير بها سلبج تزحلق وتضرب لك the adjacent soft tissue. احيانا يصير عندنا ال prolonged and excessive retraction force and pressure during the extraction of posterior maxillary teeth or mandibular teeth lead to trauma at the corner of the mouth or angle of the mouth and lips. Furthermore, a burn may occur on the lower lip if an overheated surgical handpiece comes in contact with the lips. نوبات يصير عندك surgical extraction فأنت ما رايح مندمج بالسكشنينج of the tooth وما تشوف إلا طخيت البير اللي هو يكون حار شوية باللب فيسوي لك or the adjacent soft tissue فيسوي له فد نوع من burning. Abrasion also happen when the shank of the rotating burr comes into contact with the area أو أحيانا تضرب السن المجاور أو تصلخ السوفت تيشيو المجاور للاريا of extraction. شو نسوي بهالحالة؟ When injuries are small and localized at the region of the cheek or tongue or lips, then no particular treatment, ما اكو أي إجراء، مجرد reassurance for your patient. In certain cases, healing is facilitated if the lesion is covered with Vaseline لأن يسوي لها isolation من السلايفة فيصير enhancement of healing. With any other appropriate ointment, this may also lessen the patient discomfort. And when the injury is extensive, there is even might associate with hemorrhage, the surgical procedure must be postponed and the dentist must control the bleeding and proceed with suturing حتى تحتاج أحيانا تسوتشر المنطقة. الcomplication الآخر هو fracture of alveolar process. This complication may associate with faulty extraction movement, and if there is an ankylosis of the tooth in the alveolar process, whereupon part of the labial or buccal or palatal or lingual cortical plate may be removed together with the tooth. نوبات واحد ياخذ الواهس وينزل الفورسب بيكس حتى للالفيولار process. For sure you will exert process a traumatic force over the cortical plates. إذا صار عندك قلع أو كسر or removal of part of the cortical plate شو تسوي أو كسر بيها؟ When the broken part of the alveolar process is small and has been reflected from the periosteum, then it is removed with the forceps and the sharp edges be filed تتنعم smoothened with the file and the sharp edges, if any present, are smooth. Afterwards, the area is irrigated with saline solution and the wound is sutured. If the broken part of the alveolar process is still attached, ممكن نبات تظل لازقة ويا السوفت تيشيو ويا البريوستيوم, then ممكن نرجعها adapted again and stabilized and suturing of the soft tissue. ممكن شيء مشابه آخر يصير هو fracture of maxillary tuberosity, وهذا بالذات من نقلع maxillary third molar. Fracture of the maxillary tuberosity may create a problem in the retention of the complete denture in the future. واكو problem أخرى هي أحيانا ممكن يسوي لنا exposure للlining of maxillary sinus. So بهالحالة لازم we take care in good adaptation for the socket, dental socket, and even good suturing for the socket. Weakening of the bone of maxillary tuberosity due to maxillary sinus pneumatization into the alveolar process, ankylosis of maxillary molars, decreased resistance of bone in this region due to semi-impacted or impacted third molar. عادة البون of maxillary tuberosity يعتبر tubercular bone, soft bone, لذلك it's liable to be يعني scratched off, يعني يتهشم بسرعة, مو مثل ال compact cortical bone. A treatment: if the bone segment has been completely reflected from the tissue and there is oral-enteral communication occur, the tooth is first removed and the bone is smoothened and the wound is tightly sutured with broad spectrum antibiotic coverage, and nasal decongestant are then prescribed. الcomplication الآخر هو fracture of mandible. Fracture of mandible is very unpleasant but fortunately rare. Complication that is associated almost exclusively with the extraction of the impacted mandibular third molars. A fracture may occur during the extraction of deeply impacted tooth or a tooth with a firm anchorage or ankylosed tooth. This may be easily occur when the mandible is atrophic and if the bone has become weak, such as when other impacted teeth are also present. And in the case of extensive edentulous regions and the presence of large pathological lesions in the area of the tooth to be extracted. من عندك فت periapical lesion, huge periapical lesion اللي يسوي لك weakening of the surrounded bone, or ankylosed tooth, or deeply impacted tooth. هذول انت تحط ببالك might end or the possibility of fracture of mandible. إذا صار fracture of mandible شو تسوي؟ When a fracture occurs during the extraction, the tooth must be removed before any other procedure is carried out, and in order to avoid infection along line of fracture, afterward, depending on the case, stabilization of the fractured pieces of bone, either by intermaxillary fixation or rigid internal fixation of the jaw segments, is applied for 4 to 6 weeks with a broad spectrum antibiotic coverage should be prescribed. A broken instrument in tissues. هاي الcomplications ممكن تحدث the end of the blade of various elevators due to excessive force during laxation of the tooth. Anesthetic needle ممكن تنكسر. كسر بنهاية البليد of elevator. أبير نوبات إذا أنت هواية مستعملة ممكن نتيجة الحفر ينكسر, may break during the removal of bone surrounding the impacted tooth. Treatment. أول شيء تأخذ X-ray. In this case, after precise radiographical localization, the broken pieces are removed surgically at the same time of extraction of the tooth or root. Dislocation of the temporomandibular joint. This complication may occur during a lengthy surgical procedure on patient who present a shallow mandibular fossa of the temporal bone and lower anterior articular tubercle and round head of the condylar process. إذا لازم عنده shallow mandibular fossa and low anterior articular tubercle and rounded head of the condylar process. In unilateral dislocation of mandible deviates toward the healthy side in unilateral dislocation, while in bilateral dislocation the mandible slides forward in a gaping prognathic position يتقدم الفتش كليته لقدام, and the patient is unable to close his or her mouth and movement is restricted. In order to avoid such complication, the mandible must be firmly supported during the extraction process, and the patient must avoid opening their mouth widely or excessively, especially with those of history of habitual temporomandibular joint laxation. Treatment. Immediately after the dislocation, the thumbs are placed on the occlusal plane of the teeth, while the rest of fingers surrounding the body of mandible on the right and left side. Pressure is then exerted downward with the thumbs, simultaneously upward and posteriorly with the rest of fingers, until the condyle is replaced in its original position. After repositioning, the patient must limit any movement of the mandible, which may lead to excessive opening of the mouth for a few days. لا بأس تطيله analgesic حتى لين تكون مؤلمة أحيانا الرجعة. هذا for unilateral dislocation. ترجعه by pressing downward, backward, upward يرجع الماندبل to its position. Subcutaneous or submucosal emphysema. This complication may occur as a result of air entering into the loose connective tissue spaces, and when an air rotor is used in the surgical procedure for removal of bone or sectioning of an impacted tooth. Clinically, the region swells, sometimes extended into the neck and facial area, with a characteristic of crackling sound during palpitation. يطقطق من الدوسة، ينفخ ومن by pressure يطقطق. There is no specific treatment. Usually it subsides spontaneously after 2 to 4 days. Displacement of root or root tip into the soft tissue surrounding. ممكن أحيانا tooth slippage into the soft tissue surrounding. Treatment if the tooth or root tip cannot be removed with surgical technique immediately after the complication arises. Any attempt to find the tooth or the root tip with other technique must be avoided, and the patient should inform about the situation. Antibiotic treatment and nasal decongestant are also administered, and surgical removal is scheduled. تحوله إلى maxillofacial surgeon حتى يبدي يسحب هذا القطعة راحت interrupted into the soft tissue surrounding. Because there is a risk of infection of maxillary sinus, which is usually worsened due to the existing oral-enteral communication. The exact position of the tooth or root tip must be confirmed by radiograph, and removal of the tooth or root from the maxillary sinus is usually achieved with trephination of maxillary sinus using Caldwell lock or other approach. يعني يحاول يسوي isolation maxillary sinus ويسوي لها flap خاصة ويرفع root tip or the tooth interrupted into the maxillary sinus. هاي الصور توضح لنا how a tooth is interrupted into the maxillary sinus and how by surgical procedure removed from the sinus. ممكن يصير عندنا displacement of impacted tooth or root tip into the maxillary sinus. نفس الإجراء السابق. Displacement of root tip between the bone and mucosa of maxillary sinus does not usually require any treatment. The root tip usually remains in its position and the patient is given antibiotic. The exact position of the root must be verified, though, to make sure that it is not inside the maxillary sinus. إذا صار ما بين اللايننج والبون ممكن تبقي، أو أحيانا باي سكر تسحب الروت tip. Aspiration or inhalation of the extracted tooth. بالذات هذا المراجع إذا ما يقعد راحة ممكن نبات قلعت وبعدها in the oral cavity جر نفس المراجع سحبه tooth into the airway tree. الcomplication الآخر اللي هو loss of tooth or root. Occasionally during removal of the tooth, parts of the tooth can be dislodged and disappear. If this happens, a search should be instituted using good suction, and the patient may be aware of swallowing the tooth or part of the tooth. If the tooth or root cannot be located, then a radiograph first for the abdomen should be arranged to check whether the tooth or root has been swallowed, which is most likely. It is important to ensure that the object is not in patient's airways. Roots that are elevated incorrectly can occasionally be pushed through a thin bony plate overlying the socket and disappear into the surrounding soft tissue. الحقيقة نوبات من يطول عندك القلع وتتعب وصار عندك surgical extraction نوبات يطلع الروت، بس انت نتيجة الهوسة الصايرة نوبات المراجع يبلع على الروت، ونوبات يطفر بين يتمضمض يعني spilled out يدفل المراجع. فأنت عبالك الروت انبلع، بس هو ممكن المراجع بالمضمضة شمره out of his mouth. نوصل إلى الكومبليكيشن هذا الهيموريج، وهذا نكمله بالميتنج الآخر إن شاء الله. نتناقش على موضوع الهيموريج. شكرا جزيلا وبارك الله بكم.